We will be doing something this session, as the Speaker has committed time and time again that this is one of his top priorities. I want to thank the Speaker for asking me to chair this committee. He's been a true partner in this. I think his staff is here. I'd be remiss if I didn't mention a few of the members of the committee that are here. Our ranking minority member, Jay Barrows, is here. Thank you, Jay. Our vice chairman of the committee, Tom Conroy, is here. Denise Garlick is here. And the committee has been traveling the state and working very hard, so they deserve as much credit for whatever it is we put out as anyone else. And I know there are staff from the Committee on Public Health and from the Minority Leader's Office that are here, been working closely with us. I think the Speaker has three things in mind that I feel very comfortable sharing with you this morning, and I think there's some things that we can all agree on. The Secretary had mentioned it's a $60 billion industry. The Governor mentions it's $66 billion. It's probably $70 billion that we spend on health care in Massachusetts. Probably a third of that is waste and inefficiency. That's an awful lot of money that can be squeezed out. The problem is that can't be done overnight, as all of you know. It can't be done without harming patients, hurting employment, and hurting your industry. So we have to take an approach that is very sound and very smart. You can't turn that ocean liner immediately. So the Speaker has asked us to look at this over the course of the next 3 years. And in 3 years, I think the Speaker is committed to cutting cost growth in half. Now, that's huge. When you look at the fact that we're growing at about 6.7% to 8% currently, if we can cut that in half and come down to gross domestic product or gross state product and even minus a little bit in the growth of this industry, that is enormous, enormous success for us. The second thing that I think he feels is so important is that we look at our community hospitals and we make sure that they can survive and, more importantly, thrive in the coming years. Now, what that means is something that Leader Mariano has talked about very frequently. We may have to look at some of our large providers and decide whether or not we need to make some choices in order to make sure that those neighborhood hospitals in our communities are able to survive. And the third thing that I think the Speaker has talked about, and some of you may have talked with him about, is the importance to keep consumers in the forefront of this discussion. Now, one thing we all know is health care is personal. I can tell you from my own personal experience, and a lot of us talk about this, I spent 84 nights on a windowsill at Children's Hospital with my son, who had a heart defect. Now, I want everybody in the Commonwealth to have the opportunity to get that same care when their catastrophic incident hits. Everybody should be able to go to one of our best hospitals in the world and be able to take care of your loved one. Now, that doesn't mean you need to take care of it at 400% more expensive than other hospitals. It doesn't mean we need to take care of it in a way that bankrupts our system by 2021. But it does mean that we need to be smart about this. Because when the phone rings and it's our family member or our father or our mother or our child, we're not saying how much does that cost. We're saying get them to the hospital immediately and do whatever you need to do to make sure they get healthy. That's the way we think. And when you live in an environment that has the best healthcare facilities in the world, that drives our economy, why wouldn't we think that way? Shame on us if we didn't take advantage of the industry that has made us so successful in the Commonwealth. So what the Speaker said is when you take those three principles, you need to understand that those are the things that we feel are important at the General Court. And those are the things that we won't do anything to harm as we move forward in healthcare reform. Now, that doesn't mean we won't make some major changes and probably release the boldest and most aggressive healthcare bill ever filed. And I've talked to some of you, and I know a lot of you have heard me talk about the principles of our bill, and I'll talk about them again here this morning. The principles that I think, for the most part, we can all agree on. Disclosure and transparency. Do you have a right to know the cost of the care that you are getting and the risks associated with that cost? I think you do. And if you want to make a different choice based on the information that you've given, and you want to make a different choice based on also what the Secretary said, one of the most important provisions of that, the quality of that service, then you can shop with your feet and you can make those choices. That in itself, as Charlie Baker talked about during his campaign, will help to close some of the gap. The other thing that we always talk about is patient education and consumer protection. We cannot harken back to the 90s, where patients are feeling as though they're being capitated out of services that they deserve and that they're demanding, that may be medically necessary. So you need a robust consumer protection system where if there is a problem, and you want a quick appeal as to whether or not something is medically necessary and should be provided for you, you have that. I think we will offer that. The next area that is so critically important is electronic medical records. If I go down here this morning, right behind this table, and it's about a 50-50 shot I make it through the breakfast, and you take me down to the hospital, they will not know who I am, they will not know my medical history, and you know what will happen? They will over-test me, and everybody else in this room will pay for it. That is a ridiculous system. It doesn't make any sense. Every other industry is 15 years ahead of us in terms of our technology. Banks have figured out how to make money on ATMs, so they made them interoperable. There's no reason why our records aren't interoperable. If I get onto the emergency room now, I should be able to swipe my card, and it should say, "Welcome, Steve Walsh. What ails you?" And I say, "My ankle hurts. I sprained it playing basketball last night." And they will say, "Go to the Lynn Community Health Center. We're way too expensive here to take care of your ankle." Or I will say, "I have chest pain," and two people will come out with a gurney and they will take me back and say, "We need to care for you immediately. This is an emergency situation." That's the type of medicine. That's the type of personalized medicine that's going to take place that your industry supports. That's the type of thing that makes everybody better. There's a hospital in Brooklyn right now that's toying with this idea of a kiosk system, where when you come in, you actually check in at the kiosk. And you give as much information as you can, as much as we're comfortable with, because we still have privacy rules, and we still want to make sure that our medical records, as personally are protected. But there isn't any reason, especially as we move towards accountable care organizations or integrated care organizations, that there needs to be a firewall between some of those records in systems that are networked together. That is about 2% of $70 billion. That's worth doing. The Secretary called and the Governor has supported and pushed medical malpractice. Absolutely necessary. For two reasons. Not so much that doctors lose all the time. They don't lose. They win 88% of the time. But it's 5 to 7 years of their life. It's expensive insurance. It's 5 to 7 years, more importantly, of the patient's life. And you know what happens at the end of the day? Nobody gets paid. States that are doing it right, like Michigan, Virginia a little bit, Florida a little bit, what happens is there are quick 180-day period where we work on a settlement. We have an exchange of information, and patients get money. Families get answers. That's what is most important. My grandmother had an incident when she had back surgery. It went terribly wrong. She's not litigious by nature. She didn't want to sue. To this day, she hasn't sued. She just wanted answers. You know what she had to do? She made an appointment with the same doctor, went back, waited in the room, and we came in, she laid into him, and she wanted to know what happened. She still, to this day, doesn't know what happened because our laws, it's not that doctor's fault, our laws don't allow her to know what happened. From the day you get into medical school, you're told, do not talk about it. You call the general counsel of the hospital first. That system doesn't make any sense. That's not a system that's patient-friendly. It's not about suing. It's about getting answers for you and your loved one. That's what the Governor has promoted. That's what we certainly can support. The other thing we have with expert witnesses, we have people flying in from all over the country testifying against our docs. It's a cottage industry, and it doesn't make any sense. You shouldn't be able to be a chiropractor and come to Massachusetts and testify on a cardiac case. That doesn't make any sense. That's something that we should address, and I think that we'll be able to address. The other two areas that get the most attention, but I've talked about 5 areas of low-hanging fruit that are relatively easy. The other areas that get the most attention, obviously, are the governance of this and the payment of this. Now, obviously, we need to change the way we pay. Atul Gawande has a great book, and he has the story about if we ran this like plumbers or electricians, you would have a house full of toilets and a house full of outlets because they get paid by the piece. That's what happens now. So we get over-tested. You all pay for it. It just doesn't make any sense. And why wouldn't we? I always talk about it's like an open bar. Everybody's drinking, and no one knows who's paying. So you consume more. So you get to the hospital, you say, give me one of everything. Give me one of everything. I don't know what it costs, right? You want to buy a new car. It costs about $20,000 for a new car. You test drive 8 cars, you visit 3 dealerships. Your health insurance is $20,000 a year for life, and no one in this room knows what's in it. That doesn't make any sense. That doesn't give us an educated consumer that's picking high quality over high cost and getting the right services at the right time in the right place. That's a system we all agree works. And we have to drive payment towards that system. To do that, we have to drive people back to their primary care providers. We have to begin to pay globally for those services. Payers can still hold for episodic or bundled payments over the course of the medical year, but we need to move people away from this system that is bankrupting us. And we need a governance structure that supports that. We need a very strong division of healthcare finance, a very strong regulatory body. I'm not saying rate regulation. I'm simply saying regulatory. Division of Insurance does that now. We need those folks, as the Governor has said, to be able to do the things that they need to do to continue to push the market in the direction that, yes, the market is going. Children's yesterday signed a contract with Blue Cross, 0% increase. That's great. It's exactly the way the market should be going. But all of that is happening because of the thumb of government is still on it. We take the thumb off, that is not going to continue. We're going to go back to the way it was. Now, most of the folks in this room are smart enough that you want to be sustainable. So we want to make sure that that happens. The other areas that we can look at are administrative simplification. You have one service in a hospital, you get 30 pieces of paper. Just give me a bill. American Express has figured out what I used over the course of the month and what I owe and what I have to pay. Why can't we get that in healthcare? So we see, did I have the service? What date was I there? It's pretty simple. But why don't we do it? Because it's not in our best interest to do it yet. That's the system that this governor has promoted that this legislature will change. I applaud the governor for doing something that no one else ever did. He filed this bill. He started the conversation. He has done an extraordinary job advocating for what he believes in. He's been our partner in that, and I'm proud of his work. The legislature will come to our conclusion in the near future, and I think we'll be proud of our work, and we can all move forward. Just a word about your industry, because I think it's important. Innovation does not have to be more expensive. That's why we will support innovation, because the diagnostic tests that people in this room are working on right now are less invasive and less costly than what we're doing today. So when we get that right and we strike it right, there might be an upfront cost. Absolutely. We might have to spend a little money up front. But over time, it's going to be better for the patient, better diagnosis, and cheaper. That's personalized medicine that puts the patient first. That's something we can all support. That's the kind of innovation that makes sense. That's the kind of innovation that I hope that the folks in this room that have been doing for so many years continue to do, because it's smart, it's bold, and aggressive, and it continues to put Massachusetts at the forefront. So thank you for the invitation. I look forward to working with all of you.